Earlier this month, on December 5th, health authorities in China announced the 10 guidelines for further optimization of COVID protection measures. That was actually the same day that I restarted my trip around China in my RV trailer. So I would like to share with you the most visible impact of these measures from the road. The day before the announcement, my wife and I got a COVID test in preparation for entering a new city, as was the norm back before the measures. But upon exiting the highway, we noticed that there were no checks for our travel history or for a 24-hour test. There was also no free test by the roadside at the exit of the highway. This was how travelers used to register onto a local tracing and testing system every time they visit a new city. So that's gone now. Also, there was no requirement to do daily testing for 3 days upon arrival from another area. Most Western countries had gotten lost in debates between personal freedoms and the implementation of effective precautions like mask mandates or contact tracing or social distancing. It was all surreal to me. Through the pandemic, Westerners fought for a normalcy that allowed people to die, while we here in China fought for normalcy that actually saved lives. The response has been optimized several times, following data gathered and analyzed by experts at every step, from the initial nationwide lockdown to the development of the vaccine and the rollout of the vaccine, to the implementation of dynamic measures that targeted smaller and smaller areas each time there was a flare-up. It has all been driven by science, and the response has led us to these late 10 guidelines for optimized COVID response. So, let me tell you the 3 specific reasons why COVID prevention measures have been optimized in the country. First, the vaccination rate. It has reached a tolerable level. In fact, vaccination numbers have skyrocketed over the last few days. New spray vaccination methods have been approved for population at risk here in the country, which has also helped to drive these numbers even higher. Second, the data that was collected and analyzed from recent Omicron flare-ups in Shanghai, in Zhengzhou, in Guangzhou, Chongqing, and even Hong Kong has shown the death rate is lower than previous variants of the virus. And third, there's therapeutics. Scientists in China have determined that the efficacy of TCM in alleviating the symptoms and dealing with problems derived from the virus is conclusive. So now, health professionals have alternative treatments for serious cases of people with the virus. That is what I see from the ground here in China. People are welcoming these measures and reacting to the information that is being provided to them. People understand that Omicron is not as serious as previous variants, but they also know that it is far more transmissible, so they are reacting accordingly. Now that the responsibility for our health is in our hands, people are drawing from the experience of the last 3 years, and they're adding a pinch of common sense. Now, my conclusion on these new optimized measures is quite simple. China is confident that it can lower its COVID prevention measures because it has more data, it has more tools, and is facing a less dangerous virus than in 2020.